What is disease? As nurses, we learn a very specific westernized version of medicine, and we learn it as the gold standard. Most of us were educated in programs that did not incorporate holistic or integrative modalities. In fact, many of us, like me, left nursing school with the impression that these supportive and alternative measures were somehow less than the Western medicine we're taught to practice. But I look at the word disease and I put a hyphen in there, dis-ease. This is a state of being out of alignment with ease. Now, of course, there are diseases for which our medical system is unparalleled in its cures. But we know from our experience as nurses that the majority of chronic illnesses we treat in this country cannot be fixed with a single pill or a scalpel. Chronic stress causes chronic disease, and chronic disease causes a decreased quality of life, depression and anxiety, and increased stress, which all contribute to the ongoing dysfunction and disease. Unfortunately, the healthcare system profits off this model of chronic illness, and because of that, we have built systems that reinforce and perpetuate it. I know I don't have to go into detail for an audience of nurses about what happens to our patients, or worse, if we've been that patient who's been prescribed an illness, okay, given a diagnosis. Someone goes to the doctor and they're told a story about their symptoms, where they came from and why, and usually that it will get worse. And because our culture places doctors in positions of authority, we almost always commit to this story. We remain stuck in cycles of increasing disease, stress, and suffering. We lose hope that things could ever be better because we've been prescribed decline. My name is Lisa Capitani, and I've been an RN for 18 years this month. Now I'm an endocannabinoid system nurse specialist. In 2010, I was in a bad accident that I had a lot of injuries and a traumatic brain injury from. I was told a story about why I was in pain and what would happen if I kept having pain. I was told I wasn't getting better as I should be, and that I was inevitably going to end up a drug addict. The story wasn't true, but the damage that story did to my relationship with my body and my identity was done. In 2020, I was forced to begin to reckon with this damage because my body gave up on me. I was forced to finally, after a decade of recovery, heal. And my healing wouldn't have happened if I hadn't developed a conscious cannabis practice. I'm here today to tell you about that practice. Conscious healing with cannabis is a 4-part process that encourages healing. To me, healing is when we understand ourselves and integrate our needs with our actions and beliefs. When we can meet our needs in ways that are consistent with our true self, body, mind, and spirit. Healing is caring for ourselves as much as we have cared for those we love. We are healed when we feel whole. We are whole when we are in alignment with ourself, and we live in a world where it is really hard to know yourself. We must break apart the conditioning, constructs, and systems that create barriers to our healing and wholeness. My healing philosophy uses the power of plant medicine to begin and assist this process of conscious healing. What is the most universal, remarkable, and important benefit of cannabis medicine? Is it the anti-inflammatory properties, the ability to relieve pain? I don't think so. Awareness in my conscious healing journey with cannabis began when I discovered the endocannabinoid system, or ECS. In Healing with CBD, nurse Eileen Konieczny explains that the main responsibility of the ECS is to modulate pleasure, energy, and well-being while restoring balance in the face of external stressors. In other words, the ECS creates homeostasis within the body and mind, and this condition of balance allows for rest, which activates the body's natural healing mechanisms. I believe this is the most important benefit of cannabis medicine. We know that chronic stress increases inflammation, interrupts sleep cycles, and leads to burnout and disease. A nourished and active endocannabinoid system, then, is like the antidote for that stress because of the balance it restores. Intentional cannabis use invites healing by making a space for it to begin. Brene Brown often talks about a famous quote attributed to Viktor Frankl, where he says, "Between stimulus and response, there is a space. And in that space is our power to choose our response. In our response lies our growth and our freedom." Awareness involves being present in the moment, listening to our body and spirit, and understanding our thought patterns. Cannabis can make mindfulness easier, especially for those dealing with health issues, stress, and anxiety. It can help create a state of relaxation where healing can begin, reduce that mental and physical noise, and create space for awareness. Mindfulness can help break cycles of conditioned responses by redirecting attention to the impermanent nature of things. Developing an awareness and acceptance of our experience can shift us from unconscious response patterns to active self-regulating behaviors that meet our internal needs. Before I began to practice conscious healing with cannabis, I used it pretty regularly in what I classified as recreational use. When I became aware of the ECS and began to see cannabis as a tool to help my acute medical conditions, I started using it for symptom control. I was suffering with severe pain and anxiety, primarily from PTSD. Cannabis initially provided that period of rest by alleviating those symptoms. With continued intentional use, however, I began to have moments of clarity and introspection. I believe the plant was showing me that space that Brene Brown talks about. In this quiet, I could learn why I react and behave the way I do, and how my experience of being a nurse and a patient in a broken healthcare system was impacting my body and mind's ability to even believe I could heal. As awareness and mindfulness increase, understanding begins. Initially, we use mindfulness to stop negative behavior and thought patterns, but with repetition, this becomes a new behavior and an understanding is gained. For example, the emotional freedom technique called tapping helps calm the nervous system while mentally addressing stressful situations and encouraging self-acceptance. Guided tapping exercises combined with cannabis use helped me learn to rest and relax my body while I contemplated difficult situations and feelings. Eventually, I no longer needed guidance to access this deeper level of awareness and this ability to reason calmly without self-judgment. This was so important because my mind and body had become so disconnected that neither had been safe enough to relax for over a decade. Cannabis use and awareness can help jumpstart the stop and rest phase of healing. I believe if we let the plant guide us through this practice, we can't help but deepen our self-exploration and understanding. We start to feel mindfulness pay off because we are living that experience. I know cannabis helped me to really feel the connection between my mind and body in a way that I felt like I could take back some control. It began to feel safe to listen to the signals that my body was sending me, where before my intentional cannabis practice, all I could hear was the pain. I made an enemy of my body and we stopped cooperating. Cannabis gave my body and mind a new language that allowed us to finally communicate. In the space that develops with cannabis and mindfulness, we begin to see possibilities. We start to look back and explore connections between our conditioning and our feelings, thoughts, and behaviors. How constructs like family, school, media, society, and even our training have given us false and limiting beliefs. Many start to pursue learning in this phase, absorbing self-help resources, research, and finding mentors who we resonate with that help us better understand ourselves. We use what we learn to further curate our own practices and develop a rewarding self-care routine. Conscious consumption helps stop the spiral into negative self-talk that usually follows when we respond dysfunctionally to a stimulus. When we're unwell and conditioned to by constructs that have influenced us, we often respond from fear, anger, or shame. As nurses, we've been operating in a system that for many of us does not allow us to meet a minimum standard of care. The guilt and shame that often arise from working despite these feelings is moral injury. And I know you know the impact that moral injury is having on our profession and our colleagues. I have carried guilt and shame throughout my career. My very first job offer for my dream job as a nurse was rescinded after I failed the drug test. I told myself stories over the years about why it was a good thing that I didn't get that job, but I still carried the shame. I had used cannabis throughout nursing school. Honestly, I don't think I would have made it through without it. Anyone else here nearly destroyed by nursing school? And I continued to use it to cope with the stress of being an ER night nurse in a level 1 trauma center. But I knew my cannabis use would be judged with stigma and bias. When I talk about understanding in the context of conscious healing with cannabis, I'm referring to the self-awareness and self-compassion that come when we understand the sources of our dysfunction and our limiting beliefs, the stories that we've told ourselves. And so understanding eventually leads to change. With conscious consumption, we begin to recognize patterns and determine what we have control over and what we are empowered to change. Change is understanding in action. In my healing journey, I had to understand that my cannabis use itself was an important aspect of my health and wellness. As I dove further into learning about the endocannabinoid system and cannabis in my quest to understand this plant medicine, I looked at the effects of prohibition, and I began to understand that my feelings of guilt and shame around my cannabis use as a healthcare professional were not based on anything internal, but instead were the result of years of stigma and bias caused by prohibition. I knew deep down that cannabis was good for me and that it helped me therapeutically. But my conditioning and training as a Western healthcare professional simply would not allow me to accept that. Instead, I hid it and internalized feelings of shame and inadequacy. This tendency to hide and internalize damaged my relationships and impacted my quality of life in ways that absolutely contributed to my chronic stress and disease. So change is a time for setting goals, tracking progress, and modifying our practices to really serve our needs now that we're really aware of them. We start, excuse me. Whether the change is an active choice or a natural progression, we start to integrate our new internal awareness and understanding into our lives and evaluate the impact of these changes. Like how understanding begins to occur simultaneously with awareness, change also happens both passively and actively throughout the healing process. As our perceptions change, there are subtle changes in reactions and thinking patterns that we may or may not notice. What we do notice, though, is when things get better for us. The better we feel, the deeper our practices evolve, and they become lasting changes because we feel the results and benefits of them. We started this process by building on the awareness of the space that cannabis creates for rest and healing. But as we really implement change, the purpose of our cannabis practice becomes based on a much deeper understanding of our needs. Conscious cannabis use will guide us through that space of rest and into this deeper understanding. As our relationship with the plant medicine grows and we further integrate its use into our healing journey, we start to change the way we use too. Our cannabis use might have begun like a after dinner drink kind of coping mechanism for symptom control. But with the integration of what it teaches us, it becomes more like part of a diet and exercise routine, more about wellness. Fully accepting and integrating that into my life was healing. That's why I include healing as its own step, even though it's really the outcome too. Healing is an ongoing process because we invite new awareness when we heal. We release our conditioning and limiting beliefs. and we make room for new ideas and new perceptions that require new integrations. The conditioned reactive me before conscious cannabis use would have skipped right over healing. I, like many suffering from chronic disease, was comfortable with my status quo, even though my status quo was almost entirely pain and suffering. But change is scary for our bodies and our minds. Cannabis can help us face those fears, feel less alone in our struggles, and harness our own ability to heal. As my perception and beliefs around cannabis changed with my new understanding, I also had to change some beliefs about myself and my own use. I had to drop a lot of that conditioned bias and self-judgment that resulted from seeing my own cannabis journey through the eyes of all these constructs around me. Healing then occurred when I was able to become aware of the power of cannabis to create homeostasis and healing potential within me, and how my own beliefs about cannabis prevented me for so long from acknowledging this. Then cannabis guided me to seek out a greater understanding of how it was affecting my body and mind, and how the constructs that clouded my views on cannabis also affected my perception of nearly everything else I found toxic, difficult, or painful about my life. I began to see that I am already whole. I just live within constructs and systems that are broken and encourage me to be broken to fit into them. When I really embodied this practice of conscious consumption, I was able to trust the plant to guide me and trust myself to learn. I was able to implement a healthier cannabis practice that changed my mind body connection, reduced symptoms, and improved my mental, emotional, physical, and spiritual health so that I could begin to change other areas of dis-ease in my life as well. I began to find wholeness in a broken world. Cannabis reintroduced me to myself. It taught me how to hear my body. It showed me how to make connections that would change my perceptions. It convinced me that all the preconceived beliefs I had about the plant and stoners and drug addicts were not true. When I accepted my own cannabis use as a necessary and healthy part of my healing journey, I finally gave myself permission to let go of the stories I had told myself and heal. You have my permission to do the same.